Welcome to the Gender in Focus podcast. I'm Elle, and each week I get to ask Kai Scott, the president of Transfocus Consulting, all the questions you have ever wanted to ask about trans and non-binary people in the workplace and in the wider world.
When we talk to trans and non-binary employees, if there's gender-affirming care benefits, this is a big topic of discussion. Some people will actually move jobs to go to a company that provides this type of care, especially if they really need it. And so it's a deciding factor in whether people will join a company or not.
You're just not trusted that you're an adult who can make decisions for yourself. If I think about, for example, cisgender women who want to get a hysterectomy and they haven't had children, there's this like jumping through hoops to prove that you know yourself or that you can make decisions for yourself. Like you don't need to be diagnosed with anything. You can just say, this doesn't work for me and I would like this, please. Like that's enough, or should be enough.
Most workplace health plans think they cover trans and non-binary employees. But what does that really mean? For trans employees, the details matter. Many plans treat gender-affirming care as an optional add-on, often at little to no extra cost, yet still hide big barriers like requiring diagnosis or completely missing important procedures. In this episode, we'll unpack where current benefit plans fall short, why these gaps matter, and how truly inclusive coverage is less about cost and more about care. And I'm joined by my esteemed colleague, Elle. How are you doing?
I'm doing great. How are you doing, Kai?
Fantastic. I'm glad to hear that. I'm doing well also. And I'm excited to get into this topic because for some, especially if they're in human resources, it's on their radar. For others, they sometimes are surprised by this kind of lesser known benefit that is definitely important for trans and non-binary folks.
Yeah, lesser known is definitely like the key. I think it's, I've had some really interesting conversations with other people about this because they didn't think they even realized that this was a thing that can exist. And so I guess that's kind of where I wanted to start, which is what do we mean by gender affirming healthcare benefits?
Yeah, the $1 million question actually doesn't cost that much. Here, we'll provide it for free.
HR stressing.
Yeah. Oh, really? $1 million? What? So gender affirming care benefits is this category of benefits that can be added to an existing extended healthcare benefits package, at least here in Canada. In the United States, it might be a fairly different landscape, especially in current political environment. However, here in Canada, certainly it's a much easier affair. And basically, it's everything that is useful and helpful to trans and non-binary folks. Of course, when it comes to gender affirming care, there's so many different options available to trans and non-binary folks. You know, whether it's top or lower surgeries, laser hair removal, hormone treatments, you name it. There's so many different ways that people can access care. Now, of course, not everybody is accessing this type of care, but certainly for those who need and want it, it is important to access. Here in Canada, there's a key difference in that some, especially the major procedures, are covered by provincial or territorial healthcare plans. So thankfully, it's a publicly supported endeavor, but unfortunately, it doesn't cover everything. And that's where the gaps can be closed by extended healthcare benefits for support in gender affirming care. One little asterisk that I'll add to it is gender affirming care isn't just for trans and non-binary folks. So ideally, at least in my mind, it would be something that would be offered to everyone, including cisgender folks. But for now, it's very much focused on trans and non-binary folks.
Why, when you're saying about focusing on trans and non-binary folks to begin with, why are these benefits so important for trans and non-binary people when it comes to sort of healthcare equity?
Yeah, it's critical because oftentimes these procedures, if they're not covered by public health, then that comes out of the pocket of the individual. And for some, that might be possible, especially if it's, say, a lower cost item like hormone replacement therapies. Those can range in cost per month, anywhere from $15 to $30, $50 a month. Maybe that's affordable for some folks, but for some, it's not. And
Mhm.
that's where, especially if there's multiple procedures that aren't covered, now it's starting to add up in a way that becomes inaccessible to
Mhm.
many trans and non binary folks, especially when we think about the realities of a lot of trans and non binary folks are disproportionately part of lower socioeconomic brackets. So the
Right.
affordability is a huge consideration. And if they don't have access to that care, then it has definite physical and mental health impacts on them and can make things much more difficult. And it's then harder to show up at work and to be, one's full, productive, um, integrated person. So that's where this type of care is so important, especially providing access to it.
How common is it for insurance companies to include these benefits in their plans that
Mm.
people can see at work?
It's definitely becoming better known that this is something important and that it's an option available for folks to add. Insurance companies are understanding that they can explicitly offer it, not just, kind of have people figure it out on their own, but actually put a
Mhm.
package together that that organizations can add. And so more and more organizations are adding this into, especially if there's low or no cost associated with it. It's just like a no
Mhm.
brainer, especially no cost. Like, why not? Right.
Yeah,
Um,
sure.
and so, especially as more and more employees inquire about it, or they come to know about it in some other way, maybe like this podcast, and just inquire, and then add. So we don't have the exact stats, but we will. I mean, the one thing is that we get a lot more questions about it over the years. I would say in the last,
Mhm.
especially the last 3 years, we have many more organizations coming to us to say, hey, we're thinking of adding this as an option. What are some of the considerations? And we
Oh my
kind of
gosh, that's
accompany
great.
them in that journey. Sorry, what was that?
That, that's great that more companies are thinking about it and it's sort of
Hmm.
progressing. I love that.
Yeah. Yeah.
What kind of care is typically covered then when you're working with these organizations and they're asking you like what should we be considering? What kind of
Yeah.
things do you see?
Yeah, there's a whole bunch of things that are not covered by public healthcare. Often these are described as cosmetic procedures.
Mm,
So there's a bit of a value judgment as to they're kind of nice to have versus like critically necessary.
right.
They're necessary not just from the standpoint of the individual who would need them to feel themselves, um,
Hmm.
but also from a societal perspective. If we have certain expectations in our society for how somebody should look a particular gender, and people either feel they need or they want to be able to kind of navigate life in a safe way. And so if you think about something as concrete as um, laser hair removal, for many, especially trans feminine folk, that's a really important procedure,
Hmm.
because unfortunately we don't have a lot of space in our society for women or feminine folk to have facial hair. And so as a result, that's something that they're wanting to remove. And if they don't, that they get a lot more questions, comments, stares, even barred access to
Mm.
women's spaces. And so it just really becomes complicated and difficult for them. And so those types of procedures are really critical. There's also hormone replacement therapies, which are typically not covered by public health unless you're under a certain economic bracket. Then it is
Hmm.
covered. I'm thinking, especially in BC, pharma care, and whatnot. There's also things like vocal surgeries. So, especially for trans feminine folk, unfortunately, just taking hormones won't change one's voice, so it won't
Hmm.
make it a higher pitch. It is the other way, but not for trans feminine folks. So that either vocal lessons to increase the pitch or the heighten the pitch, or vocal surgery is really key. But again, not offered because it's considered cosmetic.
Hmm.
There are various other, not necessarily medical procedures, but more on the mental health side. The ongoing support to access therapy, counselors to help not just with figuring out one's own gender, which is an important part of the journey, but even after coming out, there are various societal challenges that folks face. And it's really
Hmm.
helpful to be able to talk to somebody who is licensed, as well as equipped to talk about gender diversity issues. So, and having extra money to put to that makes a huge difference for people to be able to navigate. So there's a kind of a blend of different offerings there that are included in these types of benefits packages.
You mentioned in the intro sort of about how these are seen as sort of add-ons rather than just like as a standard part of it. And I really wanted you to go into that a bit more because there are some limitations when it comes to that. And it's
Mm.
when you're seeing this as a sort of special add-on rather than sort of a part of a standard package. Could you talk about
Right.
that a bit?
Yeah, it's so true that if it's kind of this add on, then the organization has to know about it, number one, ask
Hmm.
about it, add it. There's like so many steps to actually doing it rather
Hmm.
than just understanding as trans people are a regular part of society. And that just because of that, of course, we would add that into the mix.
Hmm.
Certainly, maybe we'll get there. I think probably for now, because there, in some instances, an added cost. There's the idea that organizations need to be aware of that they're taking on this extra cost, right?
Hmm.
So that's why it's extra. There's a few other reasons why, and that's why it gets a little more complicated. Um, because in some instances, because it's a separate thing, there's also layers of requirements to access
Hmm.
those benefits as well. And yeah, and that tension is always there in the medical field more generally. It's not just specific to insurance providers. There's this kind of, is trans health just part of regular health, or is it so special that it needs to be its separate thing?
Right.
I'll give you one guess as to where I think it is, but it okay, there are certain aspects that I can appreciate require a degree of specialty, especially when you get to the surgical aspects, no
Hmm.
doubt. But when it comes to kind of more everyday, especially hormone therapies and whatnot, that's where there's not as much specialization needed. Even though for some it feels out of their depth, but once they get into it, they realize, okay, it's not too terribly out of their depth, right? So
Hmm.
I mean, that's a kind of roundabout way of saying that for now, insurance companies treat it as separate. But I imagine
Hmm.
as we carry on, and people realize the benefits more generally, hopefully we can have that be a more general offering within the insurance
Hmm.
suite.
You also mentioned a little bit earlier about limits to access, and at least in my benefits package that I have, you need a diagnosis of gender dysphoria in order to access gender affirming care.
Mm.
And I would imagine you have some thoughts on that.
Oh yeah.
So, what are those?
What are the thoughts? Yeah, so but gender affirming care, or at least to be able to access those benefits, there's often a requirement of a diagnosis. And that's a
Hmm.
pretty general approach that insurance takes. So I don't think it's like they're specifically targeting gender affirming care and treating it in
Hmm.
this way. It's, I think, most times that this is offered, there's something extra that you have to do to get that. So
Hmm.
I
For sure.
understand it on one hand. And then on the other hand, unfortunately, there's just so many complicating factors to getting that diagnosis. And for some, they don't feel the need to get that diagnosis. Like
Mm.
there's a kind of a pathologizing of trans and non binary folks to be able to access kind of basic care. And that for
Hmm.
many feels very difficult. Like there's nothing wrong with me
For
to,
sure. Yeah.
like, and to kind of do these fancy hoop jumpings to, for whom, it feels
Hmm.
off. And also the cost of it, right? Especially there are public pathways to get a diagnosis of gender dysphoria. However, usually you have to be pursuing some form of that's covered by the province, which are usually major procedures, top and lower surgeries, for example. And some people don't want to get those surgeries. So now they're left with a private pathway of getting that diagnosis, which, depending on the therapist you go to, will require several sessions, ask all kinds of questions. Some of them feel very invasive. People are asking about all kinds of stuff. And more of that was in the past, but it still continues to some degree into the present. Things like, relationships with other people, how you have sex, like other mental health diagnoses do you have, what kind of medications are, it's just like on and on. It's just very invasive. And so that feels like a lot for what kind of benefit that person is trying to access within the benefits package. So if they're just trying to get mental health support, it feels like a very long way around to get that access, right?
And super relevant as well.
Right. Well, and you probably need therapy after having done the
Right.
diagnosis. It's just like, it's so wild sometimes, the hoops the lengths that trans and non-binary folks have to go, and this kind of bending over backwards to get some way to get something. Yeah. So I try to say, let's tie the diagnosis to more major procedures. Like if you're getting facial feminization, sure, you would want to have a bit more there to understand the exact need of that patient, right? But if somebody's trying to access hormone therapies, we don't need this rigmarole, right? Or if they're wanting mental health supports, absolutely should have for me, no barriers, right? Just
Yeah, 100%.
automatically.
Yeah.
Yeah.
Yeah. If we were to live, I ask this question every now and then. If we
Yeah.
were to live in a fantasy world that was very
Mhm.
trans inclusive,
Yes.
what would genuinely, truly gender affirming healthcare plans look like?
Mm. Well, I pan out further in that
Oh,
I
ooh,
want it for everybody. This is easy,
yes.
right? There are cisgender people who are wanting, who need hormone therapy. Like there are people who want to have a chest reduction. Like just there's so many different needs out there that if we were to broaden them and not have them be so hyper focused on trans and non-binary folks, I think it would make it that much easier, because then you're not having to kind of gatekeep that access. It's just given to anyone who needs it. And guess who identifies the need? The person themselves. And then it's
Right.
easy, done. And it's not this kind of like, oh, well, do you really need it? And, it could be something else. And, this kind of second guessing people. People have been through enough and I would imagine too, cisgender folks who have similar needs also get sometimes some flack too, right? Rather than just trusting that they know what they need and here's the options available to them and they self select. I mean, maybe that's being a bit naive, but I don't know. It seems pretty simple.
Oh, is it? Yeah. I don't think it is. Like, I think it makes me think of like how, so like you're just not trusted that you're an adult who can make decisions for yourself. If I think about, for example, cisgender women who want to get a hysterectomy and they haven't had children, there's this like jumping through hoops to
Oh, yeah.
prove that you know yourself or that you can make decisions for yourself. Like you don't need to be diagnosed with anything. You can just say, this doesn't work for me and I would like
Yeah.
this, please. Like that's enough, or should be enough,
Mhm.
that you know yourself. So
Yeah.
why not extend this?
Yeah. And then, kind of wanting them to, take time to really think it through. And so they won't regret
As if they
it.
haven't.
Well, that too, right? Usually this is
Yeah.
not like some whimsical
Just
thing. You
woke up
wake
one
up, you're
morning and
like, ah,
decided. Yeah.
that's it. Get rid of them. No, like there's usually, yeah, a really solid basis, well thought out, and you know, this whole concept of regret. I appreciate it, and some on one hand, and the other, hopefully doesn't bar people who have genuinely thought about it.
Mhm. So if an organization doesn't have this in place yet, what kinds of things could they be looking to do next? Like if they want to put that in place?
Yeah. Yeah, it's and to join with the other organizations that have already done it, I think it's a great idea. And there's a few different steps that organizations can take. We'll have these outlined in a resource that we'll have linked, so you can check it out in the show notes. But essentially, it is helpful to reach out to one's provider. A lot of them, if not most of them, now have gender affirming benefits care packages. So it's pretty straightforward to say I would like to, and then figure out how you're going to add it. I think the key thing, besides just getting the gender affirming care benefits, is to look at, what are requirements, or what does it include? What does it not include? Just so you're very clear from the outset, to make sure you're getting as much as possible. Sometimes, for example, facial feminization surgeries are not included in gender affirming care benefits. And then they're also not covered publicly. So it puts people in a real
Mm.
bind. So these are really important procedures, that is making sure that they're in the benefits package. Also, if you can push back on the gender dysphoria diagnosis, especially for access to mental health care, um, I think that's really important. Even if it doesn't go anywhere, most often the insurance companies are listening and documenting where there's pushback, and they will change things. We've seen this. We've worked with insurance companies who come to us and say, a bunch of our clients are not really happy with what we've done. What do you think we should do? So I very much invite you to say something,
Hmm.
and maybe it won't change things right away, but maybe it'll give food for thought. Um, and then it's about communicating that out to your employees as well. Because oftentimes organizations will just get the benefit and then not tell anybody. And so uh, a trans person will have to out themselves to access that benefit. And we want to try
Mm.
to get people to be able to access it, whether they want to share with their employer or not, that they're trans
Hmm.
or non binary. And so making a little info sheet, or perhaps the insurance company already has that and making that available, announcing it as well, that this is a really exciting offering. It often is not just about making sure trans and non binary folks, it's actually a positive way to signal to cisgender folks that, we're an inclusive organization and we're thinking about what specific benefits people need and going out and getting
Hmm.
those, and yeah, and then showcasing that a bit.
Could you tell us a bit more about the resource that we will link in the show notes?
Right. Yes. So this is a resource we put together based on the most common questions we get from employers about how to, get this gender affirming care benefits. Kind of outline what it entails, especially listing specific procedures, especially the ones that are not
Hmm.
covered by the public healthcare system, uh, and then giving people, organizations, options. So maybe it's about getting the extended healthcare benefits, but maybe, especially if you're a small organization, that's not possible, which is
Hmm.
understandable, especially if there's extra cost. And so there are healthcare spending accounts that can be used instead, where it's just allowing people to take that money that's been set aside for the health care spending accounts and using that towards gender affirming care, right? So, but
Hmm.
then just outlining that and describing that a bit more can be really helpful. So we just go through all of that kind of detail so that you are equipped to have those conversations, whether with the extended healthcare benefits insurance provider or options within, what is possible for your organization. And if you want any support along the way in terms of adding gender affirming care benefits to your current extended healthcare benefits package, then feel free to reach out to us. You can book time with Nico just to go over what your needs are, and then we can more carefully assess, how we can support you essentially through this journey. But we're definitely here to help if that's something of need.
Great. I will include a link to Nico's calendar in the show notes.
Mhm.
Um, Thank you so much, Kai. This has been
Yeah.
really interesting.
Absolutely. Yeah, I'm glad we were able to talk through it to make employers aware of it, as of course it's a really important need.
Mm.
And oftentimes, either it's there and is complicated to get access to it, or it's not there, and then people are disappointed. But I will say that, when we talk to trans and non-binary employees, if there's gender affirming care benefits, this is a big topic of discussion. And oftentimes some people will actually move jobs to go to a company that provides this type of care, especially if they really need it. And so it's a deciding factor in whether people will join a company or not, or go to a company that does provide it. So it's an important consideration.
Amazing. Well, thank you so much. And
Thank you.
see you next week.
All right. Bye for now.